was taking care of my mother for about 5 or 6 years. And in taking care of my mother, I didn't take care of Cheryl. I did not take care of Cheryl. I let my health go. I let my mouth go. I just let everything go except for my home life. So she passed in 2018 and seemed like 2 months after that, teeth just started falling and breaking, and I just wasn't feeling good, and I didn't know what was going on. And so I went to the dentist. Well, first of all, I talked to my husband, and he said a lot of times when you have teeth problems, it causes other problems with your body. And of course, I'm looking up Google, and it says the same exact thing. And so I decided at that time, okay, it's time for me. Let me start with my mouth. I went to my dentist that I hadn't seen in years, and he was wondering where I was. And from there, I went from the dentist to the oral surgeon.
When Cheryl came to us initially, she had been experiencing some swelling, some pain that had been going on for a while in her lower jaw. And she had just recently noticed that she had been getting a bad taste and some infection in that area. She was sent over from her general dentist for evaluation of this. She also had multiple bad teeth that needed to be taken care of.
I came here and asked me the same question, are you in any kind of pain? Are you nauseous? What's going on here? Because we're seeing this and you never complained about it. And I told him no. And he did the biopsy and found that there was some issues there. And they took the biopsy and performed the surgery.
So on evaluation, we noted that she had significant left-sided lower jaw swelling and some drainage from inside of her mouth. And her x-rays indicated that there was a large lesion in her left posterior lower jaw there that needed to be addressed. We talked to her about this and recommended surgery and a biopsy, and Ms. Epting was very receptive to this. So she underwent the procedures, and the biopsy came back as a benign lesion, which was good, but definitely needed to be addressed because it had become infected.
When I met the surgeon, his chair-side manner was awesome. He just told me what needed to be done. I felt like he treated my health as if I was a family member.
Afterwards, with the teeth extracted and the lesion gone, she had healed well. Everything came out very well. She's been to see us a couple times afterwards. Everything's healed up, and she's in a much better state now than she was when she came in, and has actually become very friendly with a lot of our staff here, and we're very happy to see a good outcome with her.
I appreciate that he did. My gratitude to him is, or to say is, I appreciate what he did and how he did it and how we got to it. Because you're dealing with two different types of, what do you call it, dentists. You have a surgeon and you have a dentist. I guess they came together and they said, this is what's going on. Do what you need to do. Surgeon, dentist, you do what you need to do. And let's make this happen for this young lady. And I feel good about it.